Trigger point cane. You're probably wondering what is it and what does it do? So trigger points are essentially muscle knots that can cause pain around different parts of your body. And to release them, usually we have to apply pressure. And this device here is a trigger point cane that has different points all around the cane, but they all do the same action, which is to release the trigger point. These trigger point spots on the cane, they improve blood flow to that muscle knot and decrease pain. So if you think of like a wrinkled shirt, how a hot iron gets out the wrinkled shirt, same thing with our muscle knot. A muscle knot is like a wrinkle, and this trigger point cane, the different points will improve blood flow and smooth out the wrinkles. How to trigger point the low back. So you're gonna find an area, usually in the low back. This trigger point cane is just for muscles. So we're not touching this trigger point cane, applying it on any bones or bony landmarks. So you really want to find a muscle called your QL. It attaches to your last rib all the way down to your pelvis. It's usually at the side of your low back. Only use this also if you're having pain or a lot of tension, right? Don't just go searching looking for trigger points. So if I palpate here on the side of my low back, I do feel some tension right there, okay? And it's very like meaty, it's a muscle here. Now with the cane, remember we have these points, to easily access it, you can use one of these areas that curves. So at the end point here, also these have numbers. This is number 11, and this is number 1. You can use either or. I'm gonna use 11, right? Just do what works best for you. I'm gonna palpate where I feel some discomfort. And then I'm gonna apply that trigger point cane there. And then I'm gonna get into that area. And remember, we're gonna take our 3 to 5 breaths. So here we go. After every breath, I'm able to go deeper and deeper. Right, and then we can find different points around that low back. So like I said, generally you just want to stay here on the side around this QL muscle, and that's pretty much where most of your trigger points would be in your low back. Once again, you want to stay away from your spine, right? There's no trigger points on the spine. You want to stay right here where you feel tension on the side of your low back, where that QL muscle is.